With healthcare costs continuing to rise, employers are really looking at all aspects of their plan and starting to embrace some creative solutions in the market in order to reduce healthcare costs, not only for their bottom line, but also to help their employees as it relates to their premiums and out of pocket costs. One thing that really caught my eye earlier this year was the concept of a virtual first health plan. And in essence, with a virtual first health plan, the member ultimately sees their primary care provider virtually or over FaceTime. And joining us today to learn more about how a virtual first health plan can help employers and employees alike, we have Matt Cook, the Chief Commercial Officer of Firefly Health, a company that specializes in just that. Hey, Matt, how's it going? Welcome to the show.
Doing great. Thanks for having me, John.
Of course. So, Matt, before we get into it, I really want to hear from you just in terms of your background and really what led you to Firefly Health.
Yeah, I think the formative years of my career, I did start at Mercer in the San Francisco office about 15 years ago. When I started, I was trying to figure out, I knew I wanted to get into healthcare, but I didn't know exactly, where or how. And so Mercer was an awesome experience because you get this real breadth of the industry. You kind of learn where a lot of the challenges ultimately lie. And so I was there for a few years. In about 2015, I went to Omada Health, which was at the time a very young conceptual idea that you could start to deliver more and more care virtually. So we focused on prediabetes and diabetes and, saw some significant growth there. And then a few kind of interim stops, but ultimately landed at Firefly coming up on 2 years ago. And was super interested in kind of what you prefaced and what we'll get into today. How do you really kind of realign or reconnect the way the member or the individual is getting their healthcare going forward, and how can you use technology to do that? So that's kind of the short story of how I got here today.
Very cool, Matt. So I guess one thing that I've heard about Firefly, right? And I guess just, one thing that some of my clients are saying, okay, the concept sounds cool, but how is it really different compared to some of the traditional telemedicine providers that have been in the market for 10 plus years?
Sure. Yeah. And I remember, I think it was in my Mercer time when, some of those early stage telemedicine companies came to be. I think fundamentally, if you think about call it telemedicine 1.0 started, what I think it was attempting to do was kind of translate the traditional fee for service interaction just to a new modality. And the idea being, hey, we want to give people better access to care, but still somewhat transactional in nature. So you might have an urgent care need, but kind of every time you call into that service, you're probably getting a different clinician, a different physician, and you have to kind of recalibrate your healthcare. And so it kind of became an urgent care modality where, hey, if I need that one thing acutely one time, this might be a good service for me, but like I have to deal with my health 365 days a year. And so I think that the kind of the impetus of Firefly, we were founded by primary care physicians. And the idea was, how do you actually deliver longitudinal, long-term primary care through this modality? One example would be, in Firefly's case, you get the same care team throughout your entire experience. You get access to a primary care physician, a nurse practitioner, embedded behavioral health, plus a few other roles where you're really staying connected, not just in your visits, but between your visits, throughout the course of your time with Firefly. So kind of changes the modality. It changes the ability for the member to get what they need. And it builds, I think, a level of trust and continuity that you just didn't see in the initial, kind of rollout of telemedicine 10 years ago.
Fair enough. So I guess one additional question just based on that is, how do members actually access care? What's that experience like?
Yeah, so you mentioned FaceTime. I also, call it FaceTime, or, I remember when it first came out, there's the concept was amazing. And so that's really, the modality for us is predominantly virtual. Some of the things that our members need, hey, I want to hop on a call for 15 minutes and talk about it live. But a lot of the interactions, like I said, are like between the visits. So they have a question around their prescription. they have a question around, a referral that was made and where they should be going, or kind of how they should be preparing. They just have like a general inquiry or a health related question. And so we see on average, it really depends on the risk profile of the member, but our members will talk to us 30 to 50 times per year through one of those modalities. And I think it shows that, beyond the 15-minute fee for service visit once a year, people have a lot more on their mind. They have a lot more going on that the traditional model just can't really support. And so I think we really do fill this gap of having that connectivity throughout the course of the year for the individual with multiple modalities and how people engage with us.
So talk to me about this, right? So if I understand correctly, with Firefly, you can actually get your annual physical virtually. How does it actually work?
Well, I would start with, there are elements of the traditional in-person annual physical that are valuable, and there are probably some that aren't. Uh, one of the common examples I use is up to a certain age in your life, you probably don't need like the banging of the gavel on your knee to make sure your reflexes are okay. It makes us feel good, I think, that like, hey, somebody's like checking the hinges and making sure everything's working. But the reality is, you can actually cover about 90% of, the traditional in-person physical or wellness visit virtually. A lot of it is, getting, baseline understanding of your health. It's reviewing lab results. It's, kind of other things if you have a chronic disease that you're managing. When we kind of engage with members, what we're finding is there's so much more that they're interested in than just that annual physical, that in many instances they really kind of reframe their paradigm for what great primary care should be and how it actually works. When we can't deliver that final 10%, and we'll probably talk about this a little bit more detail, but then we have kind of in-person partners, labs and others for people to go to kind of fill out the rest. But honestly, I think, we're finding that a lot of our members really value the way in which we're actually delivering that annual experience, knowing that they also have access throughout the course of the rest of the year. And if they can't get to everything in the 15 minutes, they have many more times in which they can engage with us.
Yeah, no, that's definitely fair. If I remember back to my annual physical earlier this year, right? I had to go out to Quest. I got my blood work. I went to my primary care provider, sat in a crowded office, right? And then finally I got seen and okay, yeah, here's the 15 minutes here, John. Okay, you got to work on, here's the one number you need to work on.
Yep.
And I'll see you in 12 to 18 months. And I'm like, okay.
Yep.
So I do think there is value there, right? If you're able to talk to your primary care provider regularly, they could do more checkups. I think that's really cool. One thing I just want to touch upon, right? So I like the concept, but how does Firefly actually save employers and employees money?
Yeah. So, I think probably the biggest evolution of Firefly in the company's journey. So I mentioned we were founded by primary care docs, really started as a advanced primary care, solution evolution. But the big kind of move for us happened in 2023, so just about 2 years ago, where what we were finding is you could deliver incredible primary care for an employer's employee or for a member of a carrier, whoever it may be, and we could do all the right things. But the minute that we sent them out for a referral, if we sent our members to, call it, the less optimal place, let's say we sent them to they had back problems, and before we go through physical therapy, we send them to a back specialist who, hey, you need the back surgery, or we send them to, that provider that's gonna, kind of maybe deliver more care or deliver the wrong level of care, not the quality of care. It really eroded a lot of the upstream value that we were actually delivering. And so, in 2023, we actually launched our own health plan with our own TPA, with our own broad network. The idea being, hey, once we have the primary care, once we have the member really engage with us, if we can help them manage kind of everything throughout their entire care experience, we can deliver much better savings. And so kind of fundamentally, there's these two big levers that I think Firefly uniquely pulls. One, we help manage utilization, and lower it in the places you want it lowered, like an ER visit, and increase it in the place you want to increase, like annual visits, labs, kind of checkup, preventative care. And then the second lever we have is a unit cost lever, meaning, we look at cost and quality data to find out where's the optimal provider for us to send a member. And what we're finding is when members kind of go where we recommend, we're saving 25 to 40% for that episode of care just by getting the member to the optimal location, whether that's a freestanding clinic for the imaging that you need to get done instead of the academic, medical center, even getting labs done at a Quest or a LabCorp instead of at the hospital setting. There's a lot of meat on that bone for us to manage. And I think what's unique about Firefly is we're able to, get members to go to these optimal places without them feeling forced or restricted or narrowed in their access, but more so because they trust us. They say, yeah, okay, I'm happy to follow your guidance, doc, for where you think the best place is for me to go and what I should do. And so we're really seeing those two levers drive our savings. In year one across our book, we usually see about a 10% total cost of care savings. So, kind of with that 11% number you shared, we're at least keeping trend flat. And then in out years, we're actually seeing bigger impact because then all that preventative work we're doing actually helps us, get ahead of that curve going forward. So a little bit of a long-winded answer. It's a lot. There's a lot more underneath that, but it really takes, I think, a level of that, depth that I just described to actually move the needle for an employer. The individual point solutions can kind of, chip away at it, but if there's not kind of fundamental rethinking of how this whole system operates, I think you're just going to continue to see that same trend happen that you mentioned at the top of the conversation.
Fair enough, Matt. Right. And that brings up an interesting point and just, something that I hear of over and over again. Right. So I think the virtual, portion is definitely great, especially that, the individuals can talk to the same primary care provider over and over again. But when it comes to accessing in-person care, right? Let's say someone has that elective surgery. You can't do that virtually, so they have to go out to the broad network. The way the average American typically figures out which healthcare provider they go to is they ask their friends and family, right? So
That's
let's
right.
say, my son, he has asthma. I'm saying, hey, Matt, who do you recommend? What doctor do you recommend or what specialist do you recommend going to for my son's asthma? And it's really not based on anything in like fact. It's just, do you
That's right.
like this, provider? Do you have a good outcome? So how do you really help get around that?
Yeah. Well, it's, I'll just say, like, it's a very fascinating topic that, like, if you were to go, I think we kind of have this idea that, like, every doctor, every provider in the country is, they've all gone through medical training. And so there's like this baseline level of like, well, they're all good. And I think the reality is, let's assume that's true for a minute. They're still on their own kind of distribution curve of how good or how, how great of an outcome they can actually deliver. So it's kind of interesting to me that, like, when I shop around for, a mechanic, which, happens, you really want to trust that mechanic. Like, you look in 4 or 5 different places. And then when it comes to our health, we're just like, sometimes, as you probably know, like, people just look at, like, where's the most expensive care? That's probably the best. Or what did my friends say? Or I'm just going to Google it. And so I think there's a massive opaqueness to cost and quality, and the average individual. And I remember the price transparency tools that came out. Hey, we're going to let people shop for their care. I don't think those things work. I think healthcare is inelastic. People, when they need it, they need it. We're not buying a vacuum cleaner here. Like, this is your health. And so you're going to kind of do what makes you feel the best and what kind of, like, what works for you in your life. I think for Firefly, we really internalized kind of why these people, why individuals, why our members make the decisions that they make. And I think there's kind of two main levers for us that help us encourage folks to look at a different option, because we still do maintain that PPO status as a plan. We're not forcing members to follow our guidance because people do want choice. But the two levers we have, I think, uniquely that maybe another carrier, or a traditional big blues plan or somebody like that doesn't have, is one, we do have that trusted relationship. So, you probably ask your friend when you don't have a great primary care doc that's like, hey, here's your care plan. Here's what you should do. Here's who you should see. Here's who I can recommend. We find that about 85% of our members will follow our guidance when they have a trusted relationship with their clinician. In the fee-for-service world, traditional healthcare, that primary care provider isn't thinking about cost and quality. They're just thinking about who they know and what system they work at. In the case of Firefly, because we have that total cost of care commitment to our employer customer, we really do look at the data and find out where we should send them. On the back end of the experience, we also have what we call a dynamic kind of plan design. And so what we've built out with our TPA partner is this idea that you as a member can go anywhere. When you do have a need, we're going to provide a couple of recommendations. And if you follow that recommendation that we provide, we will either waive or reduce your cost share to go. So we're trying to eliminate the barrier to get folks to the right place. That might mean that your copay is $0 and you just need to show up to the specialist or show up to the imaging center and kind of get the care that you need. If you don't go where we recommend, you can still go find any provider in the network. You're just going to pay the normal out of pocket that you would normally pay. So a bit of a financial incentive to kind of help the member, find the right place for them, combined with trust on the front end, is really what leads to 90% of our members following through on the guidance that we're recommending to them. And I mentioned earlier, 25% plus cost savings associated with that, without them feeling the friction of being forced to go somewhere. And I think that's what's critical with our model.
That's definitely great to hear. So one thing you touched on briefly was point solutions, right? And I'm of the opinion that depending on what you're looking to solve for, certain point solutions can be great and others of them might not necessarily be a good fit. But, one that I'm a big believer in is, the surgical centers of excellence. I believe that those have a lot of value in the marketplace, and certainly there's others in the market as well. Does Firefly Health work well with select point solutions?
Yeah. So I think, we have our primary care delivery. That's, these are full-time W-2 employees licensed in all 50 states. I mentioned that we have the ability to kind of get members, within the broad network to the right place. There's actually a step in between. We call it Firefly Nearby. And whether that's a retail clinic, an urgent care clinic, like the lab partners that I talked about, we have in-home services, and we also have point solutions, virtual point solutions that we bring, or we can integrate with the existing point solutions that the employer has. We're actually seeing that we're increasing the right point solution engagement by about 5x in certain categories, because we are the care delivery. So when you come to us as a member, and I kind of mentioned that back surgery example earlier, before we send you to a specialist in the broad network, maybe you have, maybe your employer has Hinge Health. We partner with a group called Vori Health. There's Sword. There's a lot of these, value-based digital point solutions that are a great interim step before we send you into the network. And so we work really well with those groups. We have partners in, maternal health, in MSK, in diabetes and prediabetes. We have partners in, gut health. So we have a lot of these kind of options available to the member, and they love it, right? It's just super connected to the overall experience they're having, and I do think it helps us, or we have the opportunity to help the employer get their arms around. Maybe they have 5, 6. One of our groups has 15 point solutions. Firefly can kind of act as this hub to get people to the right place because of the integrated nature of our model. So we've seen really great results in getting people to these locations or to these partners. And then we see better outcomes on the back end because these folks are better at delivering care in their specific specialty than the traditional system at large.
Fair enough, Matt. So one thing that many employers are trying to solve for, right? And I think the most recent Mercer survey of employer-sponsored healthcare did mention this, that the number one top priority for large employers was trying to do everything that they can and working with their carrier partners to try to manage high cost claims. Is there anything unique or different that Firefly does or can do to help mitigate the risk of high cost claims for employers?
Yeah, I think, our model is rooted in advanced primary care. Like I mentioned, it's an integrated team model that applies to primary care just as much as it applies to chronic condition management as it applies to high cost claimants. There are common attributes in that modality. One, members need to have 24/7 consistent access to to their care team, like especially in a high cost claimant situation where you're probably dealing with some major issues at hand. Two, um, the ability to coordinate care with other providers. Let's say you have cancer, to have your care team engage with you in working with the oncologist or the oncology team. Super important that care stays coordinated throughout the entire experience. And then three, and I don't think this gets, talked about enough and really is a struggle of traditional carriers, is how do you get upstream of the high cost claimants in the first place? Because sometimes things, of course, will happen. I think one good example for us is we are laser focused on, in this case, actually cancer screenings, right? So, breast cancer screenings, colorectal cancer screenings, making sure members are up to date on the latest screenings based off of their age and other, risk factors. And across our book, we're able to get better compliance. Actually, we get higher compliance than any other provider in the industry on getting cancer screening done early, so we can detect early, so that when that high cost does, claimant does come, or if it does come, we're well ahead of it. And that you just have to invest in. We're not a proactive preventative care kind of health system across the US, unfortunately. But that is, more than anything, I think, something uniquely, differentiated about Firefly is our ability to try to get ahead of these things as we go. So, 5%, 50%, whatever, drive 50% of the cost, whatever those numbers are. I think the reality is you got to get your arms around it. But the traditional models just don't have, I think, the level of engagement and connectivity that Firefly is, purposely built out.
Yeah, no, I think that's incredible. I mean, anything that you guys can do to help increase the cancer screenings is huge. I mean, sometimes it's hard to prove the ROI, right? Because if you catch someone in stage one or stage two cancer, there's going to be some short-term costs, but certainly better outcomes and certainly cost avoidance versus, God forbid, someone's in, stage four cancer.
Right.
So definitely like to hear that. So Matt, just out of curiosity, right? So you guys have been around and for a few years now, and really 2023 was your first, I would say real big year in this space. What's the typical profile of a company who implements Firefly?
Yeah, we talk about this a lot internally because there's some patterns of profile that I think are very common, and then there's some like these kind of unique things that we find happening. To hit on the first, I think one of the sweet spots for us is finding employer groups, of course, that have cost issues or affordability issues, but that also have nationally distributed workforces. Because we are a 50-state virtual kind of option with a national network associated, we find that groups that maybe they have their headquarters of 1,000 people, but then they have, a pocket of 500 here, a pocket of 200 there. It's hard for those groups, the ones that aren't Amazon and Walmart, to get all of their members equitable, accessible, affordable care. So, broad geography is something that we do see, a lot of groups, interested in Firefly so they can provide that to their members. Um, we do see that, we've kind of coined the phrase, we call it frontline workers. So, that could be manufacturing population, that could be retail stores. We have one great partner who has a national network of labs with people in store, in locations. People who have a large frontline worker population are really interested in Firefly. The reason being, we're almost always the most affordable plan option. We're 24/7, access. And so you think about these people who maybe they don't work the traditional 9 to 5 and they need kind of to get their care outside of those hours. Or maybe they're working a shift and the only time they're available is at, 12 o'clock on a Thursday. And so they need, they don't want to take the time to take time off of work and go talk to their primary care provider for 15 minutes, like we talked about earlier. So anyone with a frontline worker population that's focused on, hey, we have to make this a more affordable, more appealing option to our members, is something that we absolutely see. And then I think the kind of emerging insight, which I think we found fascinating, is we've had a couple of groups tell us that while they initially kind of rolled this out as as kind of the most affordable, most accessible option for a frontline worker population, they're also seeing a lot of their corporate office folks, including folks from like their C-suite, that are signing up for the Firefly plan. And they were pretty shocked by this. One group said, like, we've never had a plan where, corporate and frontline workers kind of signed up for the same plan before. And we think that's a byproduct of, if you're the frontline worker, like I mentioned, it's just really inconvenient to take time off of work. Well, if you're an executive, it's also really inconvenient to take time off of work, and go down and get the care that you need. And we see a lot of folks, like myself, that starting to get up there in age a little bit. And so they look at this plan and they say, wait, I have this 24/7 access. I have concierge navigation. I can just like talk to Firefly. They're going to figure it out for me. That becomes a really, exciting proposition for folks that maybe were on like an EPO or, a different type of plan before. So, I think there's still a lot for us to learn, but those are at least a few of the characteristics that we found to be common across the groups that we're working with today.
So, Matt, no, it's definitely very interesting. Let's say there's a broker out there or an employer, and they want to learn a little bit more about Firefly Health. Where can they go?
Yeah, you can go to our website, of course, first and foremost, which is just, Firefly. Just you can Google Firefly Health, but it's fireflyhealth.com. You can reach out to me. I can share my email. But I think ultimately, you can also reach out to a few of the groups that we work with and kind of hear their experience firsthand. We're pretty active in the conference circuit. We've had a couple different opportunities working with Mercer's national leadership to kind of present on what we're doing. So I also think a great opportunity is to talk to your consultant. Mercer's been a great partner for us in particular. And I think, consultants and brokers writ large, like yourself, are really realizing, hey, how do we think about this differently? Now, I do think the adoption curve is still like happening. We've gotten a lot of medical plan RFPs this year that are, kind of in the traditional sense. But just in the last few weeks alone, we've received multiple RFPs for an alternative or a virtual first kind of health plan concept, where they're really saying, I want to look at what else is out there beyond the traditional. One of the assets that we have that I would encourage people to look at is on our website. We have effectively a piece on like best practices for how we've seen RFPs come in, and what a consultant or an employer would be looking for. Here are the questions to ask if you're exploring these types of models. So I would encourage people to check that out as well.
Cool. Well, Matt, thank you so much for coming on the show today. I really appreciate it. And I really look forward to seeing how Firefly continues to evolve.
Awesome. Thank you, John. Appreciate the time.
Of course. And for our audience out there, we want to hear from you guys. If you're an employer, would you consider implementing a virtual first health plan? And if you're an employee, have you signed up for one of these plans? And if you did, what was the overall experience like? Comment below.